Hi, my name is Nancy Talam, and I'm going to talk about opioid crisis health policy, Department of Nursing in partial fulfillment of Nursing 548, health law, ethics and policy, spring of 2019 by Dr. Ann Feldman Althaus, Colorado State University, Pueblo. Today is April 16 of 2019. Opioid crisis definition. The scale of opioid crisis in America is really shocking. It is the deadliest drug overdose epidemic in American history. 2016, more Americans were killed by drug overdose, more than Vietnam War, gun violence, HIV/AIDS, and car crashes in 1 year. Over 170 people die from cases of overdose in the United States every day from opioids. Between 1999 to 2017, approximately 400,000 people died from opioid crisis or opioid overdose. And this is one of the things that President Trump mentioned as a crisis that has happened in the United States. The rise in opioid overdose death occurred in three waves. The first wave began in 1990 with increased prescription of opioids. Overdose death involved prescription of opioids. The second wave began in 2010 with overdose death involving heroin. And in 2013, which is actually the third wave, with a high number of overdose deaths involving synthetic opioids. And this is illicitly manufactured fentanyl. This is an illustration of the rise in opioid overdose as indicated in this diagram. Opioid overdose crisis. Much attention has been on reducing the quantity of the prescription of painkillers, yet prescription as of 2015 were still 3 times higher than they were in 1999. Other solutions are focused on stopping fentanyl, heroin from entering the country, and this has not ended the flow of opioids from other countries. Opioid crisis is a costly epidemic and it's costing the country a lot of money. The crisis has contributed to decline in average life expectancy. CDC has created guidelines for opioid prescription for patients with chronic non-cancer pain. Solution to opioid crisis. Several issues have to be considered. Translation of research to practice has been slow to reach nurses and other healthcare providers attending to patients with chronic pain and those with opioid use disorders. Public health policy makers and campaigns are not well informed for action. Believe that addiction is an issue of willpower and that the evidence-based treatment cannot lead to recovery has caused stigma and difficulty in implementation of opioid crisis policy. Recognizing opioid use condition as medical disorder, nurses can actually research on it, identify it through screening, and treat using evidence-based treatment. National and state also focuses on harm reduction strategies, increases access to medication. Increased access to medication would reverse opioid overdose through medication-assisted treatment, which is abbreviated as MAT, M-A-T. MAT medication with counseling and behavioral therapies to address opioid use disorders. MAT counteracts addiction and blocks certain receptors in the brain to control withdrawal symptoms during recovery process. The policy's effectiveness required DEA and SMHSA waiver for practitioners outside traditional federally certified opioid treatment program, doctors and other qualifying healthcare policies to treat patients using MAT. HSA stands for Substance Abuse and Mental Health Services Administration. Other program, nationwide shortage of providers administering MAT. The waiver will enable more providers prescribe buprenorphine. Challenges of the policy. Difficulty to quantify the rural and urban shortages. Wayfared healthcare providers treating fewer patients than permitted or no patient at all due to time constraint and lack of presence, psychosocial or mental health support for MAT patients. Lack of confidence in the capability of managing opioid use disorders and resistance from practice partners. Solution to these challenges. Initiatives like Vermont SHAB and Spoke model will expand availability or access to MAT, and this will also increase the number of patients accessing MAT. Target audience. The opioid crisis is a public health program, and the target audience is the general at-risk population, policymakers, and healthcare practitioners. Over 115 people in America die daily due to opioid overdose. In 2016 data, 2.5 million young people have abused opioid within the past year. Prescription opioid misuse correlates significantly with prescription opioid-related mortality and morbidity, including non-fatal and fatal overdose. In 2016, studies showed high prevalence of opioid prescription misuse among 11 years to 30-year-old. Misuse among those of 30 years and older is associated with high possibility of diagnosis of opioid-dependent abuse. Young people between 11 to 30 years desensitized on misuse burden to inform resource allocation and public health intervention. This will address prescription of opioid misuse overdose among adolescents and young adults. Strategies are also designed on young people to create positive change. Target on policymakers and healthcare practitioners will help develop and implement policies to protect the young people from opioid crisis. Senior citizens as well fall under the target audience. When senior citizens they get addicted to opioid, they end up falling, and sometimes it causes death. Neonates and pregnant women are not left behind. Study shows that there has been a significant increase in opioid misuse and use among pregnant women in the United States, especially from 2000 to 2012. This is really scary. Prenatal exposure to opioids causes NAS, which is neonatal abstinence syndrome, where opioid withdrawal at birth after prenatal opioid exposure discontinuation. NAS is temporary and can be treated, which is a good thing. However, opioid misuse among pregnant women exposes them to risk of abuse even after delivery. It puts the fetus and neonates at risk, especially by women who use illicit drugs. Therefore, this paper informs healthcare providers and women on the risk of opioid use. The opposition and fallacy of position. The opposing trends find fault in dealing with opioid crisis by restricting access to pain medication. Dealing with opioid crisis crack down on pain medication has increased opioid-related death, hence increased cases of non-medical users going into a black market. The black market medications are more dangerous due to potency and purity, inconsistency, and unpredictability. Evidence supporting my solution shows that a decline in prescription does not lead to decline in death from opioid overdose. Access to MAT thus will increase availability of more patients with opioid use disorder. Opioid use disorder is perceived as a drug problem rather than a public health issue. Some of the approaches implemented emphasize on war on drugs, leading to increase in arrest and incarceration. The effects have been scaring on most communities because they continue to access illicit market opioids. Defining opioids use as a moral failing of individuals that can be addressed through willpower ignores the role of biological triggers. Effective approaches should include reducing stigma and increasing the acceptance of treatment within the safety of federal, state, local clinical facilities. Team supporters. Advanced practice registered nurses support is very important for dealing with opioid crisis. Providing advanced practice registered nurses with an opportunity to develop a rapport with their patient through nurse-patient relationship will ensure that patients provide a safe platform on which patients can disclose their opioid problems. Advanced practice registered nurses can also raise awareness in the community, sharing the realities of crisis, working with families, dealing with negative impact, and advocating for change. Government agencies as well are part of stakeholders, and they are responsible for examining the core guidelines, policies, and regulations, and play an oversight role as the key vendors and partners. Payers and private sectors will also engage in examination of medical policies, network management, configuration, provider incentive program, and formularies. Healthcare system, on the other hand, will also examine clinical guidelines, protocols, care coordination program, physical alignment, clinical incentives, and capital expenditure. We'll not forget pharmaceutical companies. They are also important because they play a role in investing an alternative pain management solution, overdose reversal of drugs, and innovation in opioid use disorder treatment. This is just one of the results of opioid epidemic by numbers. It shows the number of people that die from opioid use. And this is my reference. Thank you very much and have a nice day. Bye-bye.